welcome to Fighting COVID with me, Antara Bose. In today's episode, we will be talking about COVID-19 in pregnant women since the Ministry of Health has added expectant mothers into the target group. As you all would remember, unfortunately, 2 pregnant women last week lost their lives due to COVID-19 at Khola Hospital, and about 40 other expectant mothers were also announced to have been infected with COVID-19 in the Sultanate. Having said that, let's have a quick recap of some important statements that were issued during the Supreme Committee's meeting last Thursday. His Excellency Dr. Ahmed Al-Saidi, Minister of Health, said on Thursday that they are hoping to receive at least 6 million doses of COVID-19 vaccines in order to vaccinate all targeted categories in the Sultanate. 2 more vaccines have been given emergency use licenses for the Sultanate, taking the total number of vaccines in use to 4. It includes Pfizer-BioNTech, Oxford-AstraZeneca, Sputnik and Sinovac vaccines. Dr. Saif Salam Al-Abri, Director General of Disease Surveillance and Control, Ministry of Health, on Thursday said receiving COVID-19 vaccines will be a must in the coming period for entering schools and other government institutions. However, he pointed out that as of now, there were no vaccinations for children below 12 years of age. Talking about the closure of airports, the Ministry of Health said that currently there are no plans to close the airports or enforce a complete lockdown in Oman, but future decisions will be based on the pandemic situation. Speaking about the lockdown, he said, "We will neither confirm nor deny reports of a complete lockdown in Oman as it depends on the situation. If a complete lockdown is announced, it will be for the safety of our citizens." 1,515,130 doses of COVID-19 vaccines have been given in Oman until last week. A total of 3,200,000 doses of COVID-19 vaccines are to reach Oman between July and September. Dr. Saif said that the presence of mutated strains of the novel coronavirus, including the Alpha, Beta, Gamma and Delta strains in the Sultanate, are pushing the spread of COVID-19 across Oman. He added that among them, the Delta variant is the most dangerous because of its rapid spread. Pregnant women have been added to the list of those in target groups for COVID-19 vaccination. The vaccines in use in Oman are deemed to be safe for this category. On that note, we'll take a short commercial break and we'll be right back. Welcome back to Fighting COVID. Now, speaking of the last point, which is the addition of pregnant women to the target group, the Ministry of Health had announced that pregnant women will be given vaccines in the second package of the National Campaign for Immunization against COVID-19. In fact, the Ministry of Health has recently issued guidelines for expectant mothers to get vaccinated and has clarified that it will include those who have completed 3 months of pregnancy. The guidelines that must be followed while taking the vaccine for pregnant women are as follows. Go to the nearest center to receive the vaccine if you have completed the 3rd month of pregnancy, which is 13 weeks or more. Bring the health record of the pregnant woman when attending the vaccination center. If you have received any other vaccine, you must wait 2 weeks before taking the COVID-19 vaccine. If you were previously infected with COVID-19, you must receive the vaccine within 4 weeks of the date of full recovery. If you have symptoms such as fever and headache, you should go to the nearest health center. If you have any known history of hypersensitivity to any vaccine, consult your doctor before taking the vaccine. Pregnant women who catch COVID-19 may be at increased risk of becoming severely unwell compared to non-pregnant women, particularly in the 3rd trimester. Doctors say that pregnant women who are in their 3rd trimester, which is more than 28 weeks pregnant, should be particularly attentive to social distancing and avoid anyone who has symptoms suggestive of COVID-19. So the question arises, does this mean that pregnant women are at higher risk from COVID-19? Well, according to the World Health Organization, pregnant women or recently pregnant women who are older, overweight and have pre-existing medical conditions such as hypertension and diabetes seem to have an increased risk of developing severe COVID-19. When pregnant women develop severe diseases, they also seem to, more often than not, require care in intensive care units when compared to non-pregnant women of reproductive age. Due to changes in their bodies and immune systems, WHO says that pregnant women can be badly affected by some respiratory infections. It is therefore important that they take precautions to protect themselves against COVID-19 and report possible symptoms like fever, cough, or difficulty in breathing to their healthcare provider. Those with the latest updates on COVID-19 on fighting COVID. For more stories, stay tuned and keep watching TTV.